common sense.
Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls. Lines open for you right here in the studio at 866-870-5752. That's 866-870-5752. You get a free book when you call the program today. It's Dr. Darrow's latest. Stem Cell and Platelet Therapy, Regenerate, Don't Operate is the title. You can also get more information by going to the website at www.lastemcells.com. That's lastemcells.com. And before we pick up Chris in Mission Viejo, did you want to say something, Dr. Darrow?
Of course. I love you, Anita. Is that good enough?
Yes, I love you more. Go ahead.
Like kindergarten, right? Yeah, there's another procedure that we do in the office, a couple of them actually, with the platelets and the stem cells, which is to regenerate the face. I do the body, but my wife takes care of cosmetics while growing back the collagen in the face and making people look younger. And then we both do hair regeneration by putting the platelets or stem cells or both into the scalp. They both work. And in my book, which you guys who are waiting on the phone just called in, we're going to send you a free copy of. There is a chapter on both of those in the back of the book that you can read. And there's tons of research in these areas, so I think you'll enjoy the book. And Chris, we're going to go to you. You have a shoulder issue. Tell us about it.
Hi, Chris. Are you there?
Yeah, yes, I am. Hi.
Hi. So Dr. Darrow's asking about your shoulder. Go ahead.
Yes, for about 5 months now, I've had some real severe pain in my right shoulder. I went to the doctor about a month and a half ago. He gave me a cortisone injection.
Yeah.
That didn't do anything. And then I called him back. I'm like, hey, this didn't do anything. I need an MRI. He got an MRI about 2 weeks ago, and it came back where I just basically have tendinitis. What he's saying.
Okay.
Okay. But it's very painful. I can't sleep on that side. I like to play golf. I cannot play golf. So anyway, I was driving and I heard you on the radio, so I thought I'd reach out.
Wonderful. So I'm glad you play golf. I'm going to take you out today when you're injured so I can beat you. We'll play for money.
Well, as long as we play for money, I'm in.
Because you've heard the story of my shoulder, maybe not if you're brand new, but I injured my shoulder back and met. You're brand new, okay. So I injured my shoulder while I was weightlifting. Back in '94, I think it was, and I had a shoulder surgery on it because I was doing orthopedic surgery. My boss did it, and it made it much worse. And it was kind of a sad thing for me, not just that it made it worse, but I was on track to become an orthopedic surgeon. And that got me off the track real quick because I was like, why would I want to do this to people and hurt people? But luckily, I discovered regenerative medicine way back then, and I healed my own shoulder. I injected my own shoulder. It healed actually overnight. And people go, you inject your own shoulder? Yeah, I've injected my wrist. I've injected both my shoulders, both my knees, both my elbows, and gotten, success healed each time. So I've also had my neck and back done, but I tried looking in the mirror and I couldn't reach, so I had to have someone else do that. But having a little tendinitis in the shoulder, that can hurt like heck, but it doesn't mean anything terrible is going on. And we heal those every day of the week. So platelets, PRP is probably an easy way to do that. And the reason that cortisone shot didn't make you feel better is because it didn't go into the place that it belonged. In other words, the doctor did not use an ultrasound. And correct, he didn't use an ultrasound to inject?
He didn't do anything. I said, hey, I got some shoulder pain, and next thing you know, he had a needle, and I thought he injected me more in the back or the top of my shoulder, not on the side.
So what happened was he was guessing where it should go. It didn't go into the pain generator. So that's not a real good thing, and it's not good that you had the cortisone in there anyway. We had a caller in the beginning of our show, the first half hour, and I told him to go look up the word cortisone, cortisone, on Google and see what it says that it does to the joints. It's not a good thing. It dissolves away the cartilage. I'm not saying that one shot's going to kill your shoulder, but it's not something that should be done, really. In my book. In traditional medicine, that's what they do.
Yeah. So can you elaborate a little bit when you say inject on your end? Is it just a single shot, or is it a process? I'm really not familiar with it.
No, it's not a single shot. I mean, shoulders are so complex that I often have to inject a shoulder maybe 30 times at the same time to hit all of the areas that may be the pain generator. Sometimes, even with an MRI or an X-ray, we can't tell where the pain is coming from. So even if you had an MRI, yours doesn't show anything, just some tendonitis, big deal. But I doubt it even shows tendonitis.
Right.
Probably it doesn't show one thing, and the doctor said, well, it doesn't show anything, so it must be tendonitis. So even when we see something like a tear, number one, that doesn't mean the tear is there, because MRIs are overly sensitive. They'll show things that aren't really there. And then the second part of it is, even if you have a tear, that doesn't mean that's generating the pain that you're having. So we have to do a good examination, and then, like I say, if I'm going to inject stem cells or platelets or both into your shoulder, I'm going to hit the areas I think it is, and then I'm going to hit all the other areas at the same time to make sure we cover all the bases and rebuild your shoulder. So what age are you, Chris? How old are you?
59.
Okay. So at 59, if you're a golfer, your shoulders are pretty beat up. And if you came in with, let's say, a rotator cuff tear, I want to rebuild that whole shoulder, not just fix that tear. Do you understand what I mean?
I do. Now, when you say rebuild, and you also mentioned like 30 shots, is that over a course of time? Is that a one-time session?
That's immediate.
Can you elaborate?
You walk in. Yeah, you walk in, we draw your blood or get your bone marrow, and then we inject you right there on the spot. The procedure takes about, maybe 45 minutes, because we have to typically will spin the blood or the bone marrow, and that's a 20-minute procedure right there. So people rest while their blood or bone marrow is getting spun. But the shots take me a minute. It's nothing to it. I use an ultrasound to look in to find the joint. It's almost impossible to hit the joint without an ultrasound, without looking and watching where the needle is going.
Oh, and that's your procedure, with an ultrasound.
Yeah, I mean, if you do a shoulder, I'm not going to take a chance. Most guys, when they think they're injecting the joint, they're not. They're injecting the subdeltoid bursa. We were all trained in med school and residency to inject the subdeltoid bursa, thinking it was the glenohumeral joint. It wasn't. How do I know that? Because I've looked with an ultrasound to see where that needle goes. We can actually see that needle inside the body using an ultrasound, so we can watch where it goes, and we can see where the solution goes. If there's a labral tear, we can put that right onto the labrum and filter in the cells from your body to help it heal up.
Okay, and so again, it could be up to 30 shots, like in one session, is what you're saying.
Yeah, but it's quick. It takes me a minute to do the whole
Correct.
thing.
Gotcha. Okay.
It's boom, boom. When people say, patients say, how many times do you inject me? And I go, it might have been, I didn't count, but it looked like it was about 30 times. And they go, I only felt one. There's something that happens when you get injected a bunch of times. You don't feel it. Now, other places, let's say a knee, which is a simple joint, it might just be one injection. Okay, so I'm not saying every time I inject someone it's a lot of pokes. But shoulders are complex. Hip joints, typically it's one injection. Fingers and feet and all that, it could be one injection. Elbows, a bunch of injections because that extensor tendon is long, and where it inserts on has to be injected all over the place and then into that joint also in the elbow. So every part of the body is different. Okay? Now the big problem is when people go to doctors that don't do a lot of this, or they go to chiropractors who bring a doctor or a nurse in that have no idea what they're doing. So I'd stay away from that. I love chiropractors because I go to chiropractors myself when I get tweaked, but I don't like if they're if they're selling stem cells and then bringing in someone who doesn't know what they're doing to just do the shots for them. That shouldn't be done.
Right. And my final question is, I've had the shoulder pain for the last maybe 6 months or so, but for a few, probably 3 or 4 years prior, I've had some elbow pain. Is that connected by any chance, or is it just, am I just out of my rocker here?
No, everything's connected. You know, what's that song? The knee bone's connected to the hip bone, all that, right? So it's connected, but I'd have to touch the area to see if it's really two separate things that are going on. A lot of times shoulders can refer pain all the way down to the elbow.
Yeah. It's funny, though. I think I had the elbow pain before I had the shoulder. Now, this could be just pure age. You know, I was just curious if it's somehow connected.
Well, I don't know if there's such a thing as pure age, because there's a lot of people that come in who are in their 90s where they have one little tweak somewhere and the rest of their body is perfect and they're still doing sports. I've had a few people 100 years old come in that are super active. So I don't know if age is a word that should be in our vocabulary anymore. There's been a change on the planet. Just like when we see these kids growing up, they're 6'4", they're 7 feet. All my nieces and nephews are giants by my standards. When I was a kid in high school, I was about 6'1", and I was the big guy. Then I got to college, and I was the small guy. You know, and now it's changing tremendously. So aging is something that, I don't know, it doesn't make sense anymore to even call it that because people do so well. We now have hormone supplementation. I've been injecting myself with testosterone since my, how old was I? My mid-40s, and I'm 72 now. And, you know, if people ask me how old I am, I say I'm 72 and I'm 16. You decide what it is, because for me, I'm 16.
Right.
You know, that I don't age.
Right.
On my what do I call it? I joke with people all the time when they ask me my age or how I'm doing. I go on my tombstone, I'm going to have it written, I'm living it up. Because I don't see a need to feel aging. That's something that is an illusion to me.
Exactly. Doctor, I use the line, only thing on me that's old is my hair. Everything else is young.
Yep, I get it, man. All right, well, God bless you, Chris. I appreciate your call, and I think your shoulder would be very simple to fix based on what you've told me. If you want to do platelets or platelets and stem cells, I have to examine you first to know if you're a candidate, but based upon what you're telling me, you're in good shape.
Thanks for your call, Chris.
I referee. Thank you very much. Appreciate it.
All right, you have a great day. I'll see you on the golf course.
Thank you too now.
Okay, our number here at the station is 866-870-5752. We have lines open for you right now, 866-870-5752. And you get Dr. Darrow's latest book for free when you call the show. It's entitled Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And the foreword is written by the actor Suzanne Summers. And If you want more detailed information, you can go to the website at www.lastemcells.com. That's lastemcells.com. And we're going to Bob in Van Nuys.
Bob, Dr. Marc Darrow, I understand that, what is it, your shoulders, your knees, and your elbow bother you? You lucky guy.
Yeah. I'm not in good shape, but I'm 62. I've worked in construction my whole life, basically, and I had some MRI. My shoulders have been killing me for probably about 8 years, and I finally went and had MRIs, and the guy said I have arthritis and bone spurs in both of my shoulders. Okay. So I went to the orthopedic guy, a doctor, a couple weeks ago, and he says you need shoulder replacement, both shoulders replacement.
Okay.
And, I mean, I don't know. Sounds bad to me. I don't know. It sounds like you have other options. I'm just wondering, what do you feel about the arthritis and bone spurs? I have a lot of pain in my shoulder, especially at night. And it goes into my bicep. It also goes into my bicep, too.
Okay.
So
that's pretty common. Can you lift your arms up in the air?
I can, but not real straight. No, I mean, not straight at all, believe me.
Well, do they go up over your head?
Yeah, I can get my hands over my head, yeah.
Okay, so here's just my simple little point of view, okay? You don't have to take this to the bank, but in my years of medicine, which has been a long time, and doing regenerative medicine and growing back tissue and getting people healed, you don't sound very bad to me. And certainly I wouldn't do a shoulder replacement. I've seen the worst results you can ever imagine, where that prosthesis from the arm doesn't even fit into the glenoid or the shoulder joint. And I've seen people lose their use of their arm completely. Now, obviously, that doesn't happen to everybody, but it does happen. I've seen terrible infections where people have been on IV antibiotics in the hospital for weeks and then at home for months. So I am not a proponent of surgery. So you have to know that when you talk to me. Okay? I was on the other side of the fence doing surgery in my training, and because of my own shoulder surgery that screwed me up really bad, I'm against surgery. Okay? That doesn't mean surgery doesn't need to have to be done sometimes. You know, you break an arm or something, you break a leg, and it's all shattered, you better get surgery. But these shoulder surgeries and knee surgeries and hip surgeries that I see, to me, should not be done. I'm not the ultimate judge because our culture says surgery is good, and I used to think surgery was the only thing that could help people before I had a surgery that failed on my shoulder, okay? That woke me up real quick. So if you've got some range of motion in your arms, I'm not going to send you to a surgeon. I'm going to use probably stem cells if you've got arthritis mixed with platelets and get those things healed up. All right?
Okay. So that the stem cell works for arthritis pretty good, you're saying then, right?
Yeah, I mean, arthritis is a lot of different things. I have to examine you to see what's going on.
Right.
I'm not going to give you a brand new shoulder, like a 15-year-old kid. But if your pain is gone and you have good range of motion, you're going to be a happy man.
Yeah, because when I try and sleep, it's not easy. I'll tell you that. Yeah. On both, and that's my right shoulder. My left shoulder, sometimes I feel like it just kind of goes out, like I can't even move it. It like pops out or something. And I got to get up out of bed and walk around and shake it, and then the pain will go away right away on my other shoulder.
Okay.
So
I'd have to check it out, see what's going on.
Okay.
I don't know exactly what that
and
means.
The other thing is, on my knee, I had knee surgery in the 80s. Whole ligaments and cartilage. I tore it all apart, and they did surgery on it. And I mean, it's okay. It was okay for a lot of years, but now I cannot bend it like like when I bend down, I can't bend down. Yep. My knee will not bend. You know, I can walk fine. I can kind of run a little bit, but bending it all the way, it won't go.
Okay. Again, I'd have to see that one. We'd take a look when you come in with an ultrasound, see if you have a bunch of fluid in there. If there is, we'd want to get that out. Nice thing about using the ultrasound is I can see every drop of fluid in there. I don't go in blind without an ultrasound. And I don't think doctors should be doing aspirations of joints without an ultrasound because they're poking a needle around. It hurts like heck, and they don't even know where they're going. All right? And I know the old ortho guys go, oh, I've done this for 40 years. But that doesn't make the patient happy, and it's a very painful procedure. The way I do it, I can see where the fluid is. I numb up the skin, and they don't feel anything after that. Okay? And I can see every drop of fluid. This is especially important if someone has what's called a Baker's cyst, which is behind the knee. I don't know how doctors can go in there blind without an ultrasound because you've got these giant arteries back there, and if you hit that, you're going to kill the nerve, and a guy could bleed out. So the ultrasound's very important.
Okay. All right. And
what about your elbow? What about that elbow?
Yeah,
what's going
what
on with
happened
that?
was I fell. I fell, and I hit my forearm and my elbow up against the side of my boat, actually. and man, when I got out, my elbow, I couldn't bend my elbow, or my forearm was killing me right in that area. And they did an MRI on that too, and they said that I tore the muscle apart basically in there. I crushed it or tore it apart.
How long ago was that, Bob?
That was about 7 months ago, in the summertime.
Is it like 80% better?
You know?
Is it 80% better?
It's a lot better, but I get a lot of pain in there every once in a while. It comes and goes, you know.
Okay.
And
well, that's another area I think that's an area that we could definitely help you with because I've seen muscles that are torn heal back up using regenerative medicine of platelets and stem cells. So I think there's good hope with pretty much everything you're talking about on your body. And I take my hat off to you for doing contracting for so many years. I think, as you mentioned that I get tons of golfers that come and I get tons of athletes, but I get tons of contractors. Your life is not an easy life. And, it's amazing you've been able to do it so long. The thing that's funny is you mentioned you fell on your boat, and I find that a lot of contractors have boats, and they played football. And there's just something about contractor consciousness that I really respect, to be able to do that hard work. You guys are sort of gladiators.
Yeah, I'm 62, I'll tell you, and I started when I was 20. And it's a hard job, but you know what? I almost enjoy it more now than I did before. It's a funny thing about it. Even though I'm in pain, I enjoy doing it still. And I'm a working contractor. I'm not paper, basically. I do the work.
Yeah.
So it's fun. I actually like it. But the first time ever in my life, I was stepping off my boat onto the dock, and the boat pushed away, and I fell back into the water, and I smashed my arm on the side of the boat. And
we're glad you're still with us, Bob, and I hope you get to water ski again soon. God bless you.
Okay. Yeah, we are out of time. Thank you for your call, Bob. Edwin, go to the website, LAstemcells.com. What am I saying? Okay. Thank you, Dr. Darrow. Thank you, Alex. Thank you, Suzette. Thank you, callers. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.